Right, guys, we'll be talking about the application of radionuclide scanning in musculoskeletal disease diagnosis, right? So you have actually suspected that the patient is down with a musculoskeletal disease. It could be fracture, it could be weakness of the joints, okay, it could be rheumatoid arthritis, it could be tumors, it could be cancer, okay. So if you want to actually verify this condition, if you want to actually verify that this condition exists, there are so many other modalities that you can actually use. Okay, and one of these modalities is what radionuclide scanning. All right, so we'll be talking about the application of radionuclide scanning in diagnosing musculoskeletal system disease. All right, in verifying that a musculoskeletal disease actually exists. Okay, so application, that's our focus today. Application of radionuclide scanning in musculoskeletal system disease diagnosis, right? So you could see this, the most suitable isotope, that's a technetium-99m, is the most suitable isotope to use for radionuclide if you want to actually focus on the bones. Do you understand? All right, now you could see this. This picture is an example of a radionuclide scanning. All right. Now let's talk a bit, guys. We said that photon emission by radionuclides taken up in specific tissues can be recorded by a gamma camera to produce an image which reflects the physiological activity in that tissue or organ. All right. Tissue, it can be bone. All right. So now the photon emissions that are actually released by the radionuclides are taken up in specific tissues and can be recorded by a gamma camera. So basically, there are some photons that are released to your body, okay, and the tissue that they are focused on will absorb these photons, right, and the image will be reflected on the gamma camera. Do you understand? Now, if you want to actually observe the bones, there's actually a specific isotope, all right, or there's a special isotope that you should use. Now, for bone imaging, the ideal isotope is a technetium-99m, okay, or it could be written 99mTc, okay. Now, it is a bone-seeking phosphate compound, okay, that is used as a substrate, okay, as it is selectively taken up, okay, and concentrated in the bone. All right. So technetium is labeled in the market as was hydroxymethylene diphosphonate, okay, and it can be labeled as was 99mTc HDP. HDP means what? Hydroxymethylene diphosphonate, right? So guys, you could see on our screen too, this is still an example of radionuclide imaging, okay. And I hope you guys enjoyed this lecture. I hope it was meaningful. We have spoken about the application of CT scan. We have spoken about the application of MRI scan in diagnosis of musculoskeletal disease. We have spoken about the application of X-rays in musculoskeletal system disease. All right. So see you guys in the next tutorial, and bye for now.